Okay, here we go. And I will turn it over to you.
Thanks so much, Katrina. I was saying it's not very common for me to meet another Katrina, so it's nice to be introduced by Katrina. And I see some familiar names. So hi, hi to those of you who I know, and welcome to those of you who I'm meeting for the first time. As Katrina said, you can move to the next slide. That's great. I'm joining you from the beautiful Okanagan Valley, which is the traditional and unceded territory of the Syilx people. I grew up close to here in the interior of British Columbia, and have spent much of my life as a guest on this territory. And I also have ties to Saskatchewan, and my grandmother was born on Fishing Lake First Nation in Treaty 4 area. So today I'll be sharing with you some thoughts and reflections about reflection. And all of this work really builds on, and some of you who have been part of the KT course on the CCGHR principles, these will be familiar to you, some of what I talk about, and I hope we'll all contribute to some great conversation in the latter part. I'm going to try and go through quite a lot of content and put some good questions forward that if we were in person, we could do some small group discussions, but we don't have breakout rooms. So we'll just do it as a large group. We can just go to the next slide. You guys are all great readers, I'm sure. And so also I just want to pause to acknowledge that the CCGHR principles for global health research, which are anchoring this presentation today, came from a series of dialogue-based research over several years, and was really led by an incredible team of lovely people to work with, all of whom are named there. And we can move on to the next slide. So I'll just start and pause with just a very brief little bit about who I am and where I come from. Katrina gave a nice overview of some parts of me in the introduction, so thank you for that. These are my two boys, my two lovely, bright-spirited kids who we spend a lot of time hiking and enjoying time beside the lake, especially in the summer, and in the mountains in the winter. Spending time outside and connected to nature is very important to me, and I try to spend time outside every day. I didn't grow up connected to my Cree culture or my grandma. I grew up very close to my grandmother. She passed away sadly when I was fairly young. I was only 12 when she died, but we were very close, and I spent a lot of time with her. And in my adulthood, especially as I became a mom, learning more and reconnecting to what she did, what she shared with me in the time that we had together, and also just understanding more of why my understanding of the world sometimes clashed a bit with some of what the world told me I should understand about it. Has made more sense as I've continued to walk a path of understanding and learning more, and especially as a mom. It also plays a big role, though, in how I think about myself and the work that I do in global health. And just as important to me in my very academic, geeky stuff that I love to do and get really deep into lots of thinking and reading and, I don't know, being very attached to my computer. I also really care a lot about art and expression and poetry. And I think this is actually a very important part of my own reflective practice. So I've just shared with you a few of the ways in which I do that, one through poetry and children's books, and another through my painting. We'll go to the next slide. So I want to just sort of lay out a bit of a story of why I think anti-colonial practices in global health matter and mattered always, but why we have new attention to it over especially the last year. But I think that our attention to it continues to deepen, but it's not a new story. So I wanted to just start with setting the stage of where I come from in thinking about global health and what I mean by equity and what definitions I use to understand equity in the world. So I really enjoy data visualizations that tell a story. So this is a cartograph that some of you who've taken other stuff with me before or talked with me before will recognize. Benjamin Henning is this cartographer who takes large data sets, and he mixes them with maps in different ways. He has a few that are international and take maps of the world and impose different kinds of data sets. So this is a global HIV prevalence data for adults, people aged over 15. And what he does is the country borders that have a proportionately greater burden of something, in this case HIV, are ballooned and exaggerated, and those that have a proportionately smaller burden are collapsed. So I'll just invite you to take a moment to just make some observations. What do you notice? You can use the chat box if you'd like. Just make some observations about what you notice about this, and then we'll go to one more in just 10 more seconds. We can turn to the next slide. So go ahead for the next slide. And here is another from the same Benjamin Henning. He offers his stuff on viewsoftheworld.net. So this is a deprivation in health looking at multidimensional poverty. And again, he's ballooned the countries that have a proportionately greater burden and collapsed those that have a proportionately smaller burden of multidimensional poverty. And this is from 2019 data. So again, just make some observations about what do you notice? Does anyone notice a pattern or a trend, or what's happening with these, with HIV or with multidimensional poverty? I could show you any number of these and they will all look very similar, no matter what condition we look at. I'm looking to the chat box, not sure if this is right, but is Canada so thin it's missing? Yeah, it's super collapsed. Canada is absolutely super collapsed. The prevalence in Western countries is a lot smaller. Yeah, Africa and South Asia have the greatest burden, absolutely. Nice to see Douglas, Connor, Ragshika, Lisa. Prevalence is highest in Africa. India and China are over. So these are proportional to population size. So it's not, this isn't just due to having larger populations, it's the proportionate burden. So absolutely, you're correct. And if we broke this down and we looked at within Canada, the distribution of multidimensional poverty, and we looked at the distribution of infectious disease or chronic disease or virtually any health outcome, we're likely to see the exact same pattern. So the pattern, you're very right to point out that the global south has the greatest burden. It's also that the greatest burden falls to countries or groups, populations that have previously been colonized. And those countries or groups that are collapsed are countries or groups that have benefited from the directional flow of colonization. So I say that very intentionally because sometimes in my global health work, I'll have colleagues say, well, Canada was never a colonizer. That's a complex question to answer. You know, Canada was maybe not the colonizer, but certainly as a country, the people who came to Canada as settlers, there were absolutely processes of colonization. And although Canada might not currently be perceived as the colonizer around the entire world, it's certainly, we cannot say that Canada, the majority population in Canada hasn't benefited from processes of colonization. So I'll move to the next slide. So this is the context in which global health work unfolds, especially because global health is a really popular term and something that in Canada we spend a lot of time talking about. We have a lot of programs for global health. We train a lot of people in global health. We have networks, and I'm involved in them, for global health research. And I thought in the presentation just before this, Dr. Ngozi Irondu raised a good point, is about, you know, there's different ways to think about global health. There are many different conceptualizations of it. Personally, I do global health by virtue of looking at the global health research community in Canada as a group, and in which I'm interested in the practices of global health researchers from the global north. I'm interested in how they work and how they work to advance equity in the ways in which they engage in global health. I'm also interested in inherently global health issues. So I'm interested in things that, in looking at local experiences within anyone's daily life, anywhere in the world, through a lens that applies a global layer of context. So I'm very interested in global political economy and how that relates to all sorts of layers of influence that actually manifest in very real differences in health and health trajectories and dignity and all of these sorts of things. How do health inequities manifest through all of these layers? So that's my own way that I think about global health. I also think I had a couple notes I want to come back to. I'm going to come back to those in just a minute. I want to say that the practice of doing global health research, no matter what kind of work you're engaged in, is incredibly complex and full of tensions, because the world is very unfair. The world is set up with a distribution of power, resources, and wealth that perpetually benefits particular groups at the cost of others. And these are long histories and long legacies. And there is an also very long history of sort of a perception that doing good in the global South is just de facto good, like that some white person going to the South on missionary work is de facto good, that those relationships are somehow out of an interest in an altruistic interest. But I actually think that those assumptions are deeply problematic. They are questioned. There's a really rich critical scholarship in this field, but it's a marginalized scholarship. And often when I engage in that critical scholarship and I draw on authors that are questioning and challenging the industry of global health and how extractive it is and how potentially exploitive it is, I get criticized for being elitist sometimes, or too leftist, as though it's affiliated with a political range. Like it can get people's backs up, because they get kind of, sometimes it's just like dealing with issues of race and racism. A lot of Canadians don't like the idea. They get very uncomfortable with the idea, especially white Canadians get uncomfortable with the idea that we participate in racism, or that there's a sort of an immediate kind of knee-jerk reaction that I'm not a racist, therefore I'm not part of it. But the reality is that whether we're doing global health work within Canada or globally, or no matter what kind of work we're doing, we are all situated in a world where colonization and its legacies continues to play a role in the distribution of wealth, power, and resources. It's not fair. The system is set up in a particular way such that some people navigate with greater advantage than others. There are grand narratives that we are told repeatedly that are part of identity as, for example, Canadians. So I have some images here that are often affiliated with very Canadian identity and pride. These narratives aren't universally good or good feeling narratives. They're very complex, and no matter what position or role or intersecting set of identities that shape us as individuals, we are all embedded in these systems. We are all part of telling and retelling stories, and therefore our awareness of them really matters. Our willingness to engage in them really matters, because we can't really be part of anything anti-colonial if we're not willing to explore and understand what the current context is like, and what its historical roots, what those historical roots contributed to in terms of shaping a current political economy that remains as unfair as it was hundreds of years ago. And I think too that assumptions that we make about our intentions are nice, and maybe we can have really nice sounding words, but intentions are only a starting place, because our actions are what matters more. So I'm going to talk to you a little bit more today about how working in global health involves choices. They're not always immediately obvious. They require a lot of self-reflection and reflection with others. And what we do can be more or less equity centered. And I think that in this field, given the realities of the work that we're doing, and this presumption that we're working on good intentions, that it is an ethical imperative, that it's not just a nice to do, it's we must do better, and we must make more equity-centered choices. Katrina, can you move to the next slide? So I think, how do I think about anti-colonial practices? I didn't always use this word. Actually, but I like this word. I like it because I think that we need to it does require unpacking, but more than unpacking, it requires active resistance and intervention and interruption. So if we want the world to look more beautiful, more hopeful, if we want more equitable futures, we actually do need to engage in practices that interrupt the grand narratives that colonialism holds in place. And I think that Ngozi raised a question before, is where does decolonizing work begin, and how do we situate ourselves in it? And I appreciated, she said, we can't speak on behalf of anyone else. None of us can, unless we are granted authority by our communities in some way. So there are some people in the world who can speak on behalf of others. I'm not one of them. I can't speak on behalf of people with mixed ancestry in Canada. I can't speak on behalf of anyone else. I can speak on behalf of communities if they've granted me that opportunity or that voice, if they've asked me to. But generally, I can only speak from a particular perspective, which is shaped by my navigation of the world. So I think that for me and others that I'm working with on this concept, on trying to think about how do we practice in anti-colonial or decolonizing ways, I really believe, and I'm very convinced that reflection is such an important first part. We have to start by learning, unlearning, relearning. We have to know ourselves and who we are in the world and where we're situated, and how our particular set of circumstances and intersecting identities shapes a particular path that we've walked. All of us walk paths to arrive at different places. And all of us, if we're sitting in this workshop, we are all privileged in particular way because we have access to internet. We have access to a computer of some kind to look at it. I am now, I have a role in a university, and sometimes I'm surprised by the amount of voice that I have. This is, right now, I have a lot of privilege. It doesn't mean my path to get here wasn't steep. And it doesn't mean that others that are standing beside me in this kind of role didn't have even steeper paths. We all have different pathways, but knowing ourselves matters. It matters too that is internal reflective work that we can engage with others in doing. And I think that can extend us and help us to grow, but we can't center our own healing journey in our work. So in order to know ourselves, we have to also know each other. We have to understand others' perspectives and others' journeys are not the same as ours. And so emphasizing mutual understanding or a willingness to understand, a willingness to engage in the world from a position of curiosity and learning and listening is another really important step in our reflective practice. This requires us to do work with other people, to listen to other people. And then I think we also really need to understand the world. We need to engage in the very deep and hard reading and learning and understanding work to understand that those data visualizations I shared with you earlier they're not coincidental. We don't have massive burdens of HIV that are so disproportionately heavy in the global South just because they're in the South. This isn't an issue of geography. It's not an accident or bad luck. These patterns are structural. They are historical. They are human caused. And we need to understand very well how our current political economy is shaped by historical legacies. So someone like me, I'm a nurse, I'm a health professional. Understanding political economy and equity matters to how well I can do my work. It matters to any of us, no matter where we are situated. If we do not understand the world, our capacity to engage in anti-colonial practices is limited, because we will not understand what direction what service we might play, how we might leverage our voice. So knowing the work requires knowing ourselves, each other, and the world. We can go to the next. So there are lots of ways to engage in this work. I think for me, this comes with I don't know, but perhaps a bias. I was the lead researcher on developing on the studies that led to the development of these principles. I keep talking about them. I keep thinking they're relevant. They keep showing up in new places. Why? I think they show up because they resonate with people, and because they actually do offer a really useful set of reflective questions for us to pause and think about different elements of how we engage in the world, how we know ourselves, how we know others. These all help us to understand what are the equity implications of anything we're doing. And who do we need to engage with in order to understand those implications better? Because we cannot on our own understand what all of the equity implications are, because we only have our path that we know and understand. And maybe we understand a greater community, but we can't possibly understand everybody's paths. And our society is set up in ways that systematically exclude particular voices and elevate others. So if we are always operating from an assumption that we can understand from our own perspective what the equity implications are, we have already missed an opportunity to foster inclusion, for example. In order to understand equity, we need to be able to create new ways to have better dialogue and better platforms for understanding others. So sometimes I'll talk about, for example, I do a lot of work right now in trying to raise awareness to issues of equity during the pandemic, and how our government's policy is contributing to inequities globally, and trying to push for more evidence and equity-informed action from the Canadian government. One of the reasons this is so important is because when we're looking at how equitable any given pandemic-related policy is, the tendency is for the decision-making tables to be particularly populated by biomedical perspectives, by professions that like epidemiology that tend to look at things from a pretty individualistic lens, or that even look at population health from a fairly biomedical lens. And so there's not always a strong integration of other disciplines that bring us a social justice or social determinants of health, or understand structural determinants of health, even though the data have shown us that there are very structural dimensions to the pandemic. Those voices aren't necessarily part of those decision-making tables. And it's also because people in positions of authority in health systems and in governments tend to be representative of particular groups and less representative of others. So the degree of diversity in decision-making tables does not reflect the degree of diversity across the Canadian population. And so we have actually already overrepresentation of some voices to the exclusion of others. And if we want to foster more inclusion and create more responsive pandemic policy, we really need to find new ways to engage with people, new ways to invite dialogue, and to be really responsive to the root causes of why particular groups are overburdened. It's not because the virus attacks their bodies in different ways. It's because there are structural and social determinants of health that make some groups particularly heavily burdened. So coming back to these principles offer a set of reflective questions that help us to actually engage in the critically reflective dialogue that we need to start exploring. How do we understand an issue? How do we understand a history? How do we understand a context? How do we design and make decisions about how we move forward and who we move forward with? They give us a moment to pause. So whether I'm a bench scientist doing discovery-based research, if I'm a pharmacist, if I'm a nurse working in an emergency room, if I'm a researcher doing work on discourse analysis, all of us face equity choices. All of us, if we want to engage in anti-colonial practices, which need to be engaged in across all layers of systems, because our systems, our institutions, our societies are predicated on a really colonial enterprise, then we need tools to do so, and we need to be doing so no matter where we are positioned in society. This is all of society work. All right, next one. I'm not going to spend too much time here. I'm just going to say that there are many resources designed around these principles to offer ways to engage in them, think about them, many different examples. The most recent being the CCGHR's strategic plan for the next 10 years. Highlights the CCGHR principles as an implementation strategy in global health. So these principles and the direction that Canadian funding agencies are going is to embrace a greater awareness of the importance of equity, and to encourage across all domains of research for research teams to think about how they are considering equity in the work that they're doing. Next slide. And I think I've spoken to most of these. So I'll just emphasize too, like, this is a picture of my son Kai when he was very little, when he put on my big rubber boots, and it was very awkward for him to walk around. But just because the work is awkward and feels uncomfortable, and because we might trip over our own feet sometimes, doesn't mean we shouldn't do it. We need to do it. We need to do it together. We need to do it even if we're not sure where we're starting. We just have to start. And it's probably going to feel uncomfortable, and we're probably going to encounter a lot of contradictions, and we're probably going to encounter a lot of pushback from different groups. None of that means we should stop doing it. It just means we have to be willing to trip on our own feet sometimes, be humble enough to, and gentle enough with ourselves to keep walking, and keep contributing in whatever way we can, knowing ourselves, knowing others, and knowing the world. We'll go to the next slide. And I think that this is, yes, good. So I've just said a lot of stuff, and I have a few reflective questions, but maybe we'll pause and see if anyone has any clarifying questions or comments. And then I'm hoping that we can, and we're not a huge group, so we might be a small enough group that we can just have a nice conversation using these questions to guide our so maybe, Katrina, could we just, actually, can I do it? I can't. Can we copy and paste those questions and just put them in the chat box, and then we can stop sharing so that we can see each other better?
For sure. I'm gonna, yeah, I can.
Actually, I have them here too.
I'll put them in, I'll stop sharing my screen, and we can